So I want to welcome everyone to this breakout session for the user group meeting on telehealth, the new normal and beyond. I'm sure all of you are within organizations that have really had to ramp up your telehealth strategy, and probably overnight or over a weekend, as I've heard many systems have had to do. So this is really meant to be a discussion. So we definitely want to hear from you, your perspective. I think the best learning comes from hearing what your peers are doing, what questions you might have of others. So please feel free to unmute and share your perspective on what your experience has been. Since it's a pretty small group in this breakout, I thought we could do some introductions. And so I'm hoping we can go around and everyone can share who they are, the organization they represent, and then if you could just relay how your role relates to the delivery of telehealth, or how your role has changed as it relates to telehealth. And then once we go through introductions, I'll kick it over to Lucy to lead the discussion. So Lucy, perhaps do you want to introduce yourself first, and then we'll go to our attendees?
Sure, thank you, Katie. Welcome, everybody. I'm glad to be here today with all of you. My name is Lucy Zielinski, and I'm the managing partner at Lumen Health Partners. I've been doing a lot of work with telehealth, from implementing to being kind of a hotline, if you will. Wrote several articles for HFMA and have done a few podcasts. So thank you for inviting me today.
Great. I wonder if we can go down and start with Gwen Marie. Gwen Marie, if you are muted if you're speaking. Okay, how about Janice Sims? I see you here.
Hey, Katie, it's Todd. She wrote in the chat that she does not have a microphone. Jay Sims, so unfortunately she will not be able to introduce. Oh, she did it in the chat though. She's Janice Sims, Director of PFS Revenue Cycle at Hunt Regional Healthcare in Greenville, Texas, a small to medium-sized hospital northeast of Dallas.
Great. Thank you, Janice. I don't know, maybe that's the same situation for others on the call. So we have some HMA staff here as well. Did I miss anyone? Is there anyone else on the phone from a provider organization? Okay. Well, Lucy, why don't we at least get started with some background information, perhaps on telehealth, and see if others join the call while we get started. I know Andrea went all the way to time, and maybe we're waiting for some additional people to join. So perhaps we move along to the next slide and start into the discussion.
Great, thank you, Katie. And if anybody's joining, if you have any questions, please feel free to ask. And I really want this to be engaging and for all of you to participate. Even if you have comments, Katie, please ask me and Todd. So let's start out by talking about telehealth. We all know that, with the pandemic, it really just catapulted telehealth. And many providers have been doing it out of the need to see patients in a safe manner. I recently ran into a statistic. It's interesting. Back in 2019, telehealth, there was about 11% of all outpatient services that were telehealth. And today, there's about 76% of the patients out there that are interested in telehealth, and probably about 50 to 60% that have adopted telehealth. So if you think about it, it has increased 4 or 5 times from what it was before. We're starting to see a little bit leveling off as, offices are now opening, but obviously I think it is here to stay. So I'll ask a few questions. I have 4 questions today in the next half hour. So I'll talk a little bit about that, but I would love for all of you to engage in some discussion and would be interested in hearing what's going on in your organizations. So the first question is around, how does telehealth fit your clinical mission? Well, that question is really critical, because at the end of the day, if you even think about value-based care, outcomes, quality care, the cost of care, all of that is so important. And so telehealth, if you think about it, what are some of those visit types or physician specialties that are providing telehealth services? And some of the visit types I've seen are the routine care, including chronic conditions. A lot of primary care and mental health have been doing virtual visits. In addition, annual wellness visits have been done via telehealth. And around physician preferences, they vary, right? So you have some of those physicians that love the work-life balance, so they're at home, half in their pajamas, half in maybe a suit and tie or whatever the case may be, and they absolutely love seeing patients via telehealth. Not only because of the safety, but I think it does create a little bit of work-life balance and better organization around time management. It's a little bit more predictable. And I've seen those who are tech savvy obviously prefer to do telehealth. However, on the flip side, I've also had physicians that have a hard time with technology, and so they've struggled a little bit, and their preference is to do either a telephone visit or the face-to-face visits. I've also seen the primary care strategy be supported with telehealth. A lot of, like I said earlier, chronic care conditions, but then urgent care as well, and home health. My mom is an elderly patient who has home health services, and she doesn't have any video technology. So when I'm over there, the nurse practitioner just says, Lucy, when you're there, just call me and we'll do a visit. And then we do that. We do that on my cell phone, and it works out great. Whereas my mom in the past probably would have not seen a doctor. It would have just been difficult to do that. So at least we have a visit that we're able to do. And then lastly, it really supports the care management, again, around value-based care and those chronic conditions. So some of the stats that are out there are that as far as the clinical opportunity with telehealth, we've seen about a quarter of visits. That's what we see the projections are being. About a quarter of all outpatient visits are done via telehealth. Probably about 20% of ED visits can be done telehealth, and about 35% of home visits can be done telehealth. So I'm just curious, and I'd love to throw it out there. What's your experience?
So, Lucy, I do want to share just a comment. Well, first of all, my neighbor has decided to aerate his lawn right now, so you may hear some background noise. But to just add to what you described, I was speaking with an organization yesterday or late last week about the specialties that were delivering telehealth in their system, and it was primary care, psychiatry, cardiology and pulmonology, and then some OB visits as well, and then lower use among pediatrics. So it just kind of goes into the different specialties that might find it more conducive to their patient population or necessary versus others. But if anyone on the call can type in the chat as well, if you're unable to unmute yourself, I can read that out loud.
Okay, any other comments? All right, we'll keep on going. So then the next thing we'd like to talk about is the operational support structures that are required to really stand up telehealth services. We had to do this really on the fly and very quick. I mean, if I could tell you so many war stories that I've had with physicians, like, how do you do this? How can I do FaceTime? what if I have background and, they didn't have the right environment, the right technology. So everybody was really trying to figure this out at the beginning. But some of the challenges that we've had is around the workflows. So when we've worked with many of the medical groups and physicians out there, we've realized that we really needed a centralized scheduling and then prepare the patient for the televisit, making sure that technology is working, making sure that all the forms are completed, making sure the physician has all the documents ready and prepped for that visit. So it was a little clunky at the beginning, but we've seen many organizations kind of iron out those workflows and create those templates, and also train the patients and the clinicians. But one of the challenges that I've seen is really integrating the technology, the telehealth visit, if you will, with the electronic health record. And so we've seen some challenges because everybody used different platforms for that. So I'm just curious out there, Katie, if you heard anything or if anybody else, what your experience has been as far as integrating the technology with the EHR.
I haven't heard so much about integration with EHR. I think some of what I've heard is just the challenges with certain, with patients in getting them up and on the platform and ready to go for the visit. And so some providers have said what they found is best is to kind of really pull care teams together to, have somebody reach out to the patient to make sure they're on the platform when the clinician is ready to see them. So there isn't a lot of time spent trying to get them used to the technology. And then just making sure that they're all ready for the visit. I think it also comes, some challenges with, the video visit versus the audio only visit is another piece that I've heard, where if you find out you can't do a video visit, you have to resort to an audio only visit. So maybe that, I've heard more of that. Not a lot about the integration, but maybe someone on the call has had that experience or has worked through that.
And feel free to put something in the comments as well. We have access to that. I know many of the systems are on some of the larger EHRs, obviously, and they're pretty well integrated. And I think when adoption first happened, of like that rapid adoption, that was definitely one of the things that was on the list. So that's definitely best practices, trying to integrate that visit, that platform with your EHR technology. Okay. One of the other things too is I've heard a lot of challenges around the time management of appointments. And so physicians were late a half hour and the patients had to sit and wait. So it's one thing to sit and wait in an exam room or in a lobby of a medical practice or in an exam room. It's another to sit a half hour at the computer. Could you imagine? That half hour seems like an hour long. So that's been one of the challenges that I've heard as well. But as organizations kind of perfected their workflows and started informing patients, they were able to manage those times. And so I always say, pad your schedule, right? Throw in some gaps just to protect that, because we know that physicians run late.
And I wonder, I guess in thinking through workflows, if just given the shift to telehealth, if you, Lucy, see a lot of it, or if anyone on the call has just repurposed staff for, for triaging patients, maybe, because they don't have the in-person visits as much, if they've used them more for the telehealth and in taking in calls and deciding whether it's appropriate for a telehealth visit, or just the shift in the way they're using their patient access staff.
Katie, I definitely have seen repurposing of staff. Again, new technology, new workflows, new policies, new procedures, and doing everything virtually. That takes a lot of work. And so what I've seen is many practices use their front office as well as their back office, their medical assistants, to help with the, with the whole process of telemedicine, preparing the patient, making sure everything's in order. So when that physician sees the patient, it's really a focused visit that's on time. So definitely, I haven't seen many groups, I've seen many groups repurpose their staff. Okay, so let's talk a little bit about the financial model. So how are you building your financial model? We're, most of us, this is HFMA, right? And most of us are finance experts or analysts or in revenue cycles. So we're constantly monitoring key performance indicators and metrics, and not only managing our revenue, but our costs as well. So I wrote an article, like I mentioned earlier. It was in the, what is this, the summer edition. It's this magazine right here. And I talked a lot about metrics, and the metrics that I've identified are listed here on these slides. So historically, we've all, right, monitored revenue and charges, the average pay per visit, et cetera, et cetera. And so one of the things I talked about in the article is then comparing your office visits compared to your telehealth visits, right? It helps you then identify what the variances are. And historically, as we look at some of the data in the last several months, we have seen that obviously the average pay per CPT code has been the same. As we know, we're trying to keep those rates as in-office rates. But we've also seen a little bit of an increase in productivity once physicians were able to manage their workflows. And so that's been great. So I'm just curious, and that's a question out there for all of you, is what has your productivity been like? Have you been able to at least stay consistent once the volume came in? Or do you see increased productivity with telehealth? So that's definitely something to take a look at. And then also some of the wait times, right? So wait times, telehealth visit, I could tell you, one of my physician friends is a primary care physician, and her average wait time was about 30 minutes in the office. It isn't that telehealth. She said, Lucy, it's 5 minutes or under. We tell our patients, you will not wait longer than 5 minutes. And so that's a patient satisfier. So curious if all of you are running your patient satisfaction scores around those telehealth visits to see how patients are responding. We have seen by some of the surveys that have been published that patient satisfaction has been higher with telehealth visits. They have better access, it's convenient, and I personally like telehealth visits, especially I just think of those patients who are chronically ill or those with a minor cough or allergies or refills or something like that. They're just more convenient to do telehealth.
And, people can go back to work. They don't have to take as much time. It's just, they don't have to worry about daycare if they have to go to the doctor's office. So yeah, I think there's so many aspects about being able to do telehealth that are certainly here to stay, because I think patients will demand it moving forward.
You bet.
Now that they've gotten used to it, right?
Yes, especially the millennials. They love this, right? I do too, though. I do too.
Yeah, I agree.
And one of the other things, we also measured the patient retention rate. One of the things, if you're in value-based contracts, as you know, it's important to keep patients in your network to be able to manage that cost of care. So if you're in an ACO or clinically integrated network and have value-based contracts, you want to be able to manage those patients and the cost of care and that quality care. And what we've seen is that leakage rate be reduced because of televisits. And so definitely something you may want to take a look at. The other thing is around payer contracting. Are you negotiating payer contracts? So with telehealth, there have been policies, but this is definitely an opportunity for all organizations to take the time and go back to your top payers and negotiate those telehealth services and the payments and include it as part of your contract, and spell it all out. This really could be your opportunity, and then tying it to some quality metrics would be great as well.
And Lucy, I was talking with someone the other day that said they're much more, their organization is starting to look more at, population-based payment models, value-based payment models, given the rise in telehealth, just the ability to control costs and manage patient care using telehealth and knowing that patients are engaged in this now. So maybe looking more at their ability to do capitation or something like that. So even kind of looking at, alternative payment models is, I think, something we might see more of as well.
You bet, you bet. And even if you think about Medicare Advantage patients, most of us, right, have Medicare Advantage population. So there's an element in there to capture those risk scores on an annual basis. So telehealth gives you an opportunity to do that annual wellness visit and grab those ICD-10 codes, those diagnoses, so then your RAF score can be accurately reflected. So there's another opportunity as well. In addition to any, like Katie, you said, the value-based contracts, if you're in an ACO and in any MSSP contracts that you may be in, this also allows you to manage that quality and cost. Good, so I'd be curious to see what all of you are tracking, and feel free to take this dashboard and gosh, we'd love to see some of your results.
And I did put a link to an article you wrote for us in the chat, and I'll have to double check if it includes this chart, but if not, I can make sure I get that chart out to everybody as well.
Perfect. Yeah, that article was the first one. This chart is in the second one. So the first one, we talked a lot about coding and comparing payments per visit.
Okay, we'll get the second one out there too.
Great, thank you. Okay, so how are you leveraging telehealth to provide value? Every organization has a strategy, wants to provide value to many stakeholders, right? Your physicians, your facility, your patients, and so on. So how are you leveraging telehealth to really provide value? So we identified a few things here, which I'll go through. So for the physician, the value is really around that work-life balance, and it allows physicians to take on some leadership roles as well and create new opportunities to manage patient care, care management, and so on. Also, we have seen some organizations include telehealth and production and quality into their compensation models and tie in some incentive payments to that as well. And obviously, the primary care physicians, it definitely provides value to them. And in the second bucket, right, we have the patient. So patient telehealth, first of all, it was safety, right? Patients didn't want to come into the office, so this gave them an opportunity to see the physician. But I think many, like we said, Katie, earlier, they like it, right? They like it and they want to keep it. They like the access and so on. And also,
yeah, and I was just going to mention, I heard from a provider that they've been monitoring medication adherence and found that medication adherence has improved with the ramp up in telehealth visits. So I think that adds to kind of the safety and the quality of care is better for perhaps for outcomes for patients as well.
Yes, that's a very good point. I'll tell you, like I was mentioning earlier, like my mom, when she knows the physician is watching her medication and asks her about those meds on a regular basis, she tends to be quiet. So it definitely works. Firsthand, I had experienced it.
Oh, funny, yeah.
Mm-hmm. Also, there's a lot of remote data monitoring too. The CPTs and the reimbursement, there's more codes now. We're seeing Apple Watch do many things now, like the Fitbits. They have like EKG monitoring and pulse ox. So there's a lot of, I call them gadgets, right? There's so many gadgets out there and that are reimbursable for remote data monitoring. You see how it starts too. organizations in providing these devices. And then we talk about value-based care, right? So not only do this course improve satisfaction, and that's the public reputation of the organization and the provider. Those are public orders. But if the organization is participating in this, or the ACO gives that organization an opportunity to address some of those measures using telehealth. We talked about coding and the risk scores and annual visits. So really it's a course the value-based care strategy of any organization. And then the healthcare facility definitely provides value. We've seen, like I mentioned earlier, provider productivity increase. We haven't done a lot of work on return on investment. And literally, we have taken some dollars to ramp up the services. But I'd love to kind of track the cost versus the cost of providing offices. And my expenses are typically 20 to 50% less providing telehealth services. And also, again, provide an opportunity for that payer contracting. So definitely, if organizations haven't entered that yet with their managed care teams, they definitely should be taking a look at their contracts and how do we leverage telehealth, how do we negotiate contracts with including the telehealth and telehealth services.
Lucy, I noticed your audio was breaking up just a little bit there, but it got a little bit better. So I'm not sure if it's the Wi-Fi or the internet access or.
Okay, I think it might be good now.
Now it sounds fine to me. But.
Okay, great. All right, so we have a few more minutes here. So I'm just going to bring this home. So kind of in summary, I think we all know that we're still in the state of transition, but adoption has occurred. I think telehealth will continue to promote innovation in the healthcare industry. Patients like it, providers like it, medical groups like it, CFOs like it, and it just provides that convenience, that access to care, and keeps patients in the network, especially when we're talking about value-based contracts. It makes healthcare more efficient. So I'm just curious to hear what everybody's kind of story is moving forward into that new normal, right? Moving forward, how are you all leveraging telehealth, right? And curious how finance leaders what kind of financial models they're doing and how are they finding the value to manage that margin? Because we know that margin is pretty tight these days, and many CFOs are addressing financial recovery initiatives and how telehealth plays in it. And I really think many organizations can leverage telehealth to support their financial recovery strategy.
I agree, Lucy. Thank you so much. I think there's so much that we've learned over the past few months, and HMA is going to continue to provide resources and tell the stories of our members on how they're really navigating this new state that we're in. There's there's still much to come regarding certainly the federal government's role in payment of telehealth. So we'll have a lot more information after the pandemic ends as well. But it's been quite a learning process, right? And we thank you for your help and your guidance. And I shared the second article that you referenced in the chat as well, and we can make sure we get that that resource to the rest of our UGM audience. So thank you for doing that. I think we are at time right now, if I have it correct. So now it's time for a break, and then everybody kind of goes back into the full user group meeting, I think in 15 minutes, so at 3:30 Central Time. Great, thank you.
Thank you,
Thank you, everyone.
Thank you, everyone.